What's the difference between a moral agent and a moral patient? It's not the case that agents and patients are both good or ethical or righteous or moral. So this word moral might be a little bit confusing. Instead, a moral agent is somebody who can make decisions about what to do and has to be considered when asking the question what we should do. Whereas a moral agent is not someone who can make decisions about what we should do, but someone who still needs to be considered when we're trying to figure out what to do. Let's break that down. Ethics is a subfield in philosophy concerning what you're allowed to do and why you're allowed to do it, when you're allowed to do what, and what justifies being able to do that. So ethics is all about your behavior or habits. That is a way too quick explanation for what ethics is. Nevertheless, when you're trying to answer those questions, another question will come up. Who or what should we consider in our decisions? So as you're trying to decide what you should do, who do you think of affecting? Some of your actions might be really, really positive for certain people, but really, really negative for other people. The moral community is the set of people or things that you care about. It's the people you think about affecting and whether your action, your potential action, is going to leave them with a consequence that's better for them or worse for them. Anybody or anything who you are considering whether your decision is going to affect them positively or negatively is called a moral patient. But just because you should consider them and what your actions will leave them with doesn't mean that they can actually decide. Think about your dog. Before you go on vacation, you might consider, before you make a decision about where to go, how long to go, what's going to happen to your dog? Who's going to feed the dog? Are you going to take the dog? Who is going to walk the dog? While the dog can't make decisions about what we should do, you should consider the dog when thinking about what to do. So the dog is an example of a moral patient. It belongs in the category of the moral community, making it a moral patient. It's someone who you should consider before you make decisions, even though it's not a moral agent. A baby cannot make decisions about what we should do. However, it's in the moral community. The baby should be considered when making decisions about what to do. A moral agent, on the other hand, is a person who is able to make decisions about what we should do. Part of the reason why we can hold adults, rational adults, responsible for their actions, in other words, we hold them accountable, is because that they have the capacity to make decisions about what to do. They're not just reacting to their environment, unlike a dog. A rational adult human can have the capacity and does have the capacity to make decisions, moral decisions. Those are decisions about right and wrong. And also, rational human adults can be held accountable. They can be praised or blamed for their decisions. Unlike the baby and the dog, a baby doesn't have what it takes to make decisions about what's right and wrong. A baby cannot be held accountable and be blamed or praised for what they end up doing. Two questions. One is, why did I have to write the word rational in front of adult human? If there's an irrational adult human, that person would be unable to make decisions about moral things. They would also not be held accountable for their actions when it came to moral things, but they would still be a moral patient. We should consider how our actions will affect them, but they're not in the moral community insofar as they are also decision makers. So that difference does exist. Another separate thing to wonder here is, why did I have to add moral decisions or moral actions? Why are these called moral patients and agents? The reason is that babies, infants, they can make decisions. You can say, do you want apples or oranges? But we don't ask babies to make decisions when it comes to morality. We do hold babies accountable for their actions, but not when it comes to moral actions. And that's why this word moral is in front of the agent versus the patient. So the next time you're trying to figure out what to do when it comes to a moral question, the people or the things that you're considering affecting, those are moral patients. And moral patients are not moral agents, but moral agents are moral patients.